If you've ever had a seizure, you just know how scary, of course, it can be. We'll tell you about a new clinic at Intermountain Medical Center that has some pretty big advancements in epilepsy. People looking for ways to control their condition have been coming to right here into Murray, Utah, the Intermountain Medical Center, where the Epilepsy Clinic has only been open for a few months, and they've already made huge advancements in healthcare. Kate's first major seizure is a blur.
I don't remember, but she does.
They started the summer of 2006 and came out of nowhere.
They were grand mal, and I didn't see the first one, but I saw the after effects of the first one. And she was just, nobody was home. She had her eyes open, she was blinking, but she wasn't responsive.
After testing, Kate found out she is one of 3 million people nationwide that have epilepsy.
You have to have had at least 2 unprovoked seizures to be considered to be epileptic.
Dr. Constantino is a neurologist at the Epilepsy Clinic at Intermountain Medical Center. It's here where specialists determine if a person's seizures are really epilepsy.
What that means is that somebody's having abnormal electrical activity in their brain, and you could consider it a brainstorm.
It's a condition that is usually misunderstood by most people.
Most people, when they think of a seizure, think of a grand mal convulsive type seizure, where someone stiffens, shakes, loses consciousness.
The truth is, there's a spectrum of how intense the seizures can be for each person.
The more common type of seizure actually is what we call a complex partial seizure, where somebody has a brief confusional episode. They may not know what happened unless somebody tells them.
And epilepsy does not discriminate. Half the time it shows up in people without any kind of prior illness or trauma.
And that's also a difficult thing for people who develop it in midlife, who've probably been healthy previously, and suddenly out of the blue they develop epileptic seizures.
People living with epilepsy also face obstacles that can be socially and economically devastating.
What my patients tell me is they can get a job, but then as soon as they have a seizure on the job, everyone gets scared and they lose their job.
Once a diagnosis is made, there are some options neurologists consider for treating the patient based on the frequency and intensity of the seizures. Sometimes that can be brain surgery.
And it's scary for a lot of patients to consider the possibility of brain surgery. That's a big deal.
For Kate, it was an option she hoped to avoid.
I was thinking at that time, I don't want half of my brain gone. I don't want that to happen.
Instead, Kate came from her home in Idaho to the Epilepsy Center at Intermountain Medical Center, where Dr. Constantino decided to implant a vagal nerve stimulator on the left side of Kate's chest.
Sends out an electrical impulse that travels up the vagal nerve.
These impulses travel along the vagus nerve and help to prevent seizures.
We program it initially to go off every 5 minutes. We start at a very low stimulation level, gradually increase that over time to the level that's going to be most effective for somebody and that they're going to best tolerate.
And so far, the results have been great for Kate.
It's helped me be able to be less stressed and paranoid. I could just take my magnet and send extra boost and stop it.
It's a better life for Kate, who after graduation plans to pursue a career where she gets to help others.
I like helping people feel better. That's why I also want to do massage therapy, get them out of pain.
Kate was the sweetest, most mature, high schooler I've met. She comes down from Idaho,
really?
Actually, yes, to come to this
clinic. I watch these pieces and I'm just amazed with technology and all the things that have just been advanced lately. It's crazy.
Well, Kate's suffering with epilepsy for years now. She was having numerous seizures a week, and having the implant, it has cut down dramatically. She's a singer. She's a singer, and she's able to carry on with her life and being able to control that device while outside of her body, so she could turn it off when she sings or when she's exercising. She has the capability of doing it, being just more in control. So it's pretty amazing.
Great work being done there.
Yep. If you want more information, go to Intermountain Healthcare's website at intermountainhealthcare.org.
There you go.
Yeah. We have more to come. Still